Today I want us to focus our attention on the ABO blood group system. There are a number of blood group system, but the ABO blood group system is the one that we are most concerned about in the general terms. However, there are other blood group systems which are clinically significant, which we'll be getting into in a few moments. But when we're talking about the blood group system, I want you to bear in mind that we are trying to communicate the predominant blood that we see in the body, in circulation, the system of ensuring that oxygen is reaching the vital and critical organs and systems for the optimal functionality. So that is the system that we're talking about. We're not talking about the white blood cell. We're not talking about any other blood cell. We're talking about the red blood cell when we're talking about the blood group system in this segment. So the ABO blood group system is one of the most important of all the blood group system in both transfusion and transplant medicine. It is only blood group system that we use to identify and distinguish between individuals, and we can determine who has what antibody, who has what antigen based on the presence or absence on the red blood cell. Without prior exposure, an individual has an ABO system, in that some antibodies are developed based on exposure to a antigenic influenza. It may be bacterial, it may be a transfusion, it may be someone else's blood or something of that nature can generate different antigenic responses which change and modify your blood group observation. But the blood group system in and of itself remains the same or constant from birth till departure in this realm, right? So we have seen persons who have in pregnancy have some change in how their blood group system works. Different situations can cause undue change in the blood group system operation, which we'll get into in a little while. But the most important thing that I want you to know is that if you don't know any other blood group system, the blood group system that you need to know is the ABO blood group system. And then the question may be asked, what is your blood type? So when people ask what is your blood type, they're usually referring specifically to this blood group system. Are you A? Are you B? Are you O? Or are you even AB? But that system is different from the resource system, which is the D, which is where we said, are you A positive? Are you A negative? So the positive and the negative would be the rhesus. And the name rhesus was because it was derived from a rhesus monkey investigation. So that is why we have these different systems. And the systems are there to aid in ensuring that the blood that is transfused to a patient is beneficial. It is there to ensure that the organ that is transplanted to a patient will operate in the way that it was intended to operate, and we won't have graft versus host disease setting in, or we can reduce and eliminate most of those adverse outcomes. So we need to understand the blood group system for the ABO. And when you're thinking about the ABO blood group system, I want you to think about whatever is in the forward cannot be in the reverse. All right. So if the person is A, they that means that they have on the red blood cell there is the A antigen binding site, which means that they could not have A antibodies, because A antigen and A antibody comes together and form agglutination, and that would be devastating. So that there is a mismatch. So in that situation, you know that the antibody in circulation that we're looking for would be the opposite. That is the only way a person can live normally. All right. So if the person has A antigens, we are expecting them to have B antibodies. If a person has B antigens on the cells, the red blood cells, we're expecting in circulation them for them to have D. That's correct. So they're B, so they have A. They have the opposite. All right. So let us get a little bit more complicated. If a person has O, what is taking place? The person has O antigens, which means that they don't have A nor B on the red blood cell. That means they will have both A and B in circulation. All right. Simple as that. Now, if a person has AB, both A and B antigens on the red blood cell, what are we thinking? It means to us then, if it's all in the opposite, it's all in the reverse, we are thinking that they have no A antibodies and no B antibodies. And if you thought that, then you'd be perfectly correct. So this system is so simple that we can understand it, others can understand it, nurses can understand it, the physician can understand it and appreciate it. So this is what we normally use in the initial stages of determining someone's blood transfusion viability and the availability of bloods that are available. All right. And after we have done that, we would move now on to an IAT situation where we're trying to find out are there any active antibodies taking over, which could complicate the reaction. And if the reaction is complicated, then we will not be able to just transfuse based on a room temperature crossmatch. We would have to do an immunoglobulin crossmatch. But before we can do the immunoglobulin crossmatch, we have to find out first what antibodies are causing the reaction that are not expected. So they are unexpected reactions, right? Because it's not following the normal protocol. And in those cases, the blood delivery may take a little longer. All right. So based on what we have discussed, you know a person who is O is considered to be the universal donor. All right. Which means that when we're talking about O, we're talking about the cells, which means that we have extracted the plasma portion or the liquid portion from the blood itself, which means that those circulating antibodies would be too low to create or evoke a significant reaction. All right. So the person who can receive from anybody based on what they have in circulation is a AB individual. So they are the universal recipient. All right. They have both A and B antibodies. So they can receive from a person who is A, they can receive from a person who is B, they can receive from a person who is O, they can also receive from a person who is AB. That is for the blood portion of it, the red blood cell section. When it comes on now to the plasma portion or the FFP or the cryoprecipitate, we have to be a little bit more specific. So let's talk about the FFP. When it comes down to the FFP, based on the fact that they have no A's and no B antibodies in circulation, we don't want to put anything in their circulation, because if we do that, then they will have a transfusion reaction. They would have an adverse reaction, which can cause the termination of their existence in this reality, and we don't want that. All right, so when we think about things from this perspective, we are now positioned to engage with the ABO blood group system. All right, so it's that simple, but there are some caveats that we need to understand in order to better prepare ourselves to dissect the other blood group systems. But for now, this is a brief introduction overview. So I hope that it was enlightening, it was insightful. And the question that you may be asking yourself is, what is my blood group? If you don't know your blood group, I think it would be a good idea to figure out what your blood group is. If you are a O negative person, it means that you are the universal donor. You can give to anybody your red blood cell. We're talking about the packed cells, not the whole blood. All right? In a situation where they need blood and blood products, especially if their hemoglobin is low, they're bleeding out, and we don't know the blood group, and your health history, which means that you don't have any disease that can be transmitted through a blood transfusion situation, then you'll be good to go. And if you think that you're a healthy person, it would be advised that you will donate blood, so that blood will always be available in circulation. And depending on which jurisdiction you are in, when you donate blood, you will know how many lives that one unit that you have donated would have saved. Thank you very much for sharing some time with us and for enjoying this experience where we examine in brief the ABO blood group system, as we try to simplify so that everybody can understand. It was indeed a pleasure to serve you, and in the next sitting we will continue our conversation as we embark on understanding the complexities and the gravitas of this system, while we move into a subsequent system and we see how this impacts immunohematology, blood banking. Thank you, and have yourself a blessed day. Until we meet again, class is dismissed.